Hopefully you can see the slide deck here. Yes, perfect. Okay, so really, as I said, we'll start off with the welcome and introductions. The agenda for today is really to talk about the impact of flu and the flu activity that we've seen in the last 23-24 flu season. We'll also be talking about the flu vaccines that will be available for this upcoming season, how you can order the vaccine, how you're supposed to store them, the recommended eligible groups for vaccination, the operational pathways, and how they can get how the eligible cohorts can get the flu vaccine. We'll also be touching very briefly on the PPV23 vaccination program and touch on the ICT system for recording both flu and PPV23 vaccines. Talk a little bit about the resources that are available. And we'll be touching on some of the commonly asked questions to the NIO from the clinicians, and we'll answer any questions as we go along. If there's any burning questions, we can take those in the last few minutes. So supposed to start off with the effects of flu. Although flu may be asymptomatic in 3/4 of cases, it's important to note that flu outbreaks result in significant morbidity. And flu illness is more severe in the elderly, in those with chronic heart and lung disease, in younger children under the age of 4 or with cerebral palsy, and also in pregnant women. It's worth noting that 80 to 90% of reported deaths from flu occur in the elderly, mainly for secondary bacterial pneumonia, but also from exacerbations of underlying disease, for example, COPD or cardiac disease. And just to talk about the importance of the flu vaccine, I wanted to highlight some of the stats from a particularly severe flu season, which was in 2017-18. So during that season, the sentinel GP influenza-like illness consultations were higher than in previous 5 seasons, peaking at about 111 per 100,000 population. There were 4,713 cases of flu that were admitted into hospital, 119 admitted into critical care, and the highest admission rates were among the elderly aged 65 and over. The number of deaths, unfortunately, was 255, and the deaths occurred both in the community and hospital settings as well. And there were around 223 confirmed flu outbreaks reported that season. So comparing that, I suppose, looking at the flu activity for the last season, which was 2022-2023, during that season, there were about 16,000 laboratory confirmed cases of flu, primarily flu A. There was about 4,604 cases admitted into hospital, 185 cases where people were admitted to critical care, particularly highest among people aged 65 and older again, and there were unfortunately 198 deaths notified in influenza cases reported to HBSC. And what's also important to note is that the flu season that has just gone by in 22-23, we also faced a multi-pathogen winter. So we not only had flu circulating, but we also had RSV and also COVID-19 co-circulating as well, which made it really complicated, I suppose, for our health and care services. And this is just a bit of a graph to show how our flu cases for the 2022-23 season compared to the previous 6 seasons as well. So you'll see the 2022 and 2023 season started earlier and had the peak was earlier than in previous seasons, you'll notice. So how was the flu activity in Europe? So for the previous season that's just completed, I suppose there was also a marked return to flu activity to almost pre-pandemic levels seen in most of Europe, and the season was characterized by an earlier start of the seasonal epidemic, not dissimilar to Ireland, and also an earlier peak in positivity compared to the previous 4 seasons as well. So again, this is just a bit of a graph showing the trend in Europe as well compared to the previous seasons. And I suppose when we talk about flu activity, people are always really interested in Australia, and I suppose it's one of the markers that we look at as well. They've just going through their flu season this summer. So one of the key things to note is that they've had notification rates that have been highest, particularly in children. So for example, the highest rates have been in children aged 5 to 9 years, followed by children aged 0 to 4 years, and then 10 to 14 years. It's also worth noting that they've also noticed that 72% of people admitted with confirmed flu across the Sentinel hospital sites were in children under the age of 16. Although the clinical severity of the season to date, which was measured by patients admitted to ICU, and deaths-associated flu is low. And it's also worth noting that the majority of flu samples that were tested were characterized as antigenically similar to the corresponding vaccine components. So, but they are still waiting for formal, I suppose, vaccine effectiveness rates to be published. One of the, I suppose the three things that I probably take from the data from Australia is one, when our Director of Health Protection was talking to the CMO from Australia, the key thing that was highlighted was around vaccine fatigue. I think particularly coming out of the pandemic, I think there's been a lot of messages around vaccination. So it's not unusual to think that there would be vaccine fatigue out there. So it's just mindful for vaccinators to be aware of that and how they communicate with people so that they can make an informed choice about vaccination this season. It's also worth noting that we are seeing earlier flu season in Australia. So it is, and we saw that in our own season, the previous flu season that we've just had. So it is important that those who are vulnerable are vaccinated early so that they are protected, because it does take about 2 weeks for the flu vaccine to kick in as well, for the protection to kick in. So it's just important that those who are vulnerable are protected earlier this season. And also it's worth noting the impact on the children that it's had. So, one of the key focus for this flu season is improving the uptake rates for children. I'll talk a little bit about that a bit later on. And in the latest WHO surveillance report as well, it's worth noting that they state that, a clinician should consider flu as a differential diagnosis, which I'm sure you all will be, especially for the high risk groups for flu, and you should be testing and treating according to the national and WHO guidance. And it's worth noting that, obviously vaccination remains the best protective measure for prevention of flu. So moving on then, we'll be talking about the flu vaccines that will be available for this current season, the upcoming season, 2023-2024. So there'll be two types of flu vaccines that will be available. So the first one is Influvac Tetra, which is a non-live quadrivalent influenza vaccine, or QIV. It's cultured in fertilized hen's egg, and it's a surface antigen inactivated, and it comes in a pre-filled syringe for intramuscular injection. It's licensed for use from 6 months of age onwards. It's manufactured by Mylan. And in terms of storage, all flu vaccines should be stored at 2 to 8 degrees. And if the vaccine has been frozen, it shouldn't be used. And the shelf life for Influvac Tetra is 1 year from until the end of the season. But always make sure that you look at the expiry date of any vaccine that you're about to give. The next flu vaccine that we have is Fluenz Tetra, which is a quadrivalent live influenza, attenuated influenza vaccine, or LAIV. This is produced in Vera cells and cultured in hen's eggs, and it comes as a nasal spray suspension. It's licensed for use from 24 months of age to 17 years old. It's manufactured by AstraZeneca, and again, it should be stored at 2 to 8 degrees. And the shelf life for this vaccine is shorter than the QIV vaccine. It's only 8 weeks from the date of manufacturing. So it's really important for this flu vaccine that you look at the expiry date on the vaccine itself before administering. This is what the product looks like. So just looking on the right-hand side of the screen, we have the LAIV, which is Fluenz Tetra, which is the nasal spray that I mentioned. This is available through the HSE program for all children aged 2 to 12 years, and also children aged 13 to 17 years at increased risk of flu-related complications. And I'll go through the eligible changes to the eligible cohorts in a second. And the other flu vaccine that we have is on the left, which is the QIV, which is the Influvac Tetra. This is for all eligible populations aged 6 to 23 months and 18 years or older, and also in children who are contraindicated LAIV. So just moving on, I suppose, diving a little bit deeper into the QIV in terms of dose and administration. As I mentioned, it's licensed only for those aged 6 months and over. It comes as a suspension in pre-filled syringes in boxes of 10, and the vaccine should be allowed to reach room temperature before use, and you should shake before use and visually inspected prior to administration. And the vaccine, when inspected, should not be used if foreign particles are present in the suspension. The vaccine, after shaking gently, is a colorless liquid, and the dose is 0.5 mils given by intramuscular injection into the anterior lateral thigh for children aged 6 to 35 months, or into the deltoid for those aged 36 months onwards. The dose of the quadrivalent influenza vaccine for those children aged 6 months to under under 9 years, it's 2 doses 4 weeks apart if they're receiving the flu vaccine for the first time or you don't know what their vaccination history is. For patients post stem cell transplant or post solid organ transplant, it's 2 doses 4 weeks apart if they're receiving the flu vaccine for the first time post transplant. For cancer patients who are receiving the vaccine while on chemotherapy and who complete their treatment in the same season, it's 2 doses, and the second dose is at least 4 weeks after completion of chemotherapy and at least 4 weeks after the first dose, regardless of flu vaccination in previous seasons. But note, for the general majority, you just need 1 dose of the flu vaccine per season. The contraindications with regards to the QIV vaccine include anaphylaxis following a previous dose of the flu vaccine or any of its constituents. You should read the manufacturer's summary of product characteristics to see the full list of ingredients. The next contraindication is for those with severe neutropenia. They should not receive any vaccines to avoid an acute vaccine-related febrile episode. This doesn't apply to those with primary autoimmune neutropenia who can get the flu vaccine unless other contraindications. It's also worth noting that patients on combination checkpoint inhibitors should not receive any flu vaccines because of the potential association with immune-related adverse reactions. There are some precautions associated with the QIV vaccine, and this includes acute severe febrile illness. Vaccination should be deferred until recovery. And if the flu vaccine is recommended for children aged 12 to 23 months of age, it should be separated from the PCV vaccine by at least 1 week. This is due to the slightly increased risk of febrile convulsions if the vaccines are given at the same time in this age group. The other precaution is with the egg allergy, which we get quite a few questions around. So it's worth noting that those with a confirmed egg allergy or egg anaphylaxis can be given this influenza vaccine in a primary care or a school setting, with the exception of those who have required admission to ICU for a previous severe anaphylaxis to egg. Those requiring non-live flu vaccine who've had a previous ICU admission for a severe anaphylaxis to egg should be referred for specialist assessment with regards to vaccine administration in hospital. Next, moving on to Fluenz Tetra, which is our LAIV vaccine. This is supplied in a box of containing 10 single applicators. It comes in a pre-filled nasal applicator, and each applicator contains 0.2 mils of the nasal suspension. It's ready to use, no reconstitution or dilutions required. It's pale yellow, clear to aplacent, and small white particles can appear. The light, just in terms of looking at how many doses of LAIV are required. So the license documentation reports that all previously unvaccinated children should require 2 doses 4 weeks apart. But the evidence states that, that we've seen in the real world states that there's adequate efficacy after 1 dose of LAIV in healthy children. Therefore, NIAC recommends 1 dose for healthy children. Other countries such as the UK and Finland also recommend 1 dose for healthy children. So based on NIAC recommendations, it's worth noting that table there in terms of the dosage of LAIV. So really, it is only children aged 2 to 8 years old who are medically at risk and who've never had any type of flu vaccine before require 2 doses 4 weeks apart. So that's the only children that require 2 doses 4 weeks apart. Otherwise, other children just require 1 dose of LAIV this season. In terms of, it's worth revisiting the steps in terms of intranasal administration of LAIV. So, the step 1 is take out only 1 applicator out of the fridge at a time. Again, as I iterated before, due to the short expiry date, you should check the expiry date on the vaccine before administration. Remove the nozzle tip protector, but don't remove the dose divider clip, and place the tip of the applicator inside the right nostril with the child in upright sitting position. Advise the child to breathe normally, and there's no need to inhale or sniff. Depress the plunger quickly until the dose divider clip prevents further administration. You should then pinch and remove the dose divider clip, and then insert the applicator into the left nostril and depress the plunger as quickly as possible until all the vaccine's been given. Then you should dispose of the nasal applicator in the sharps bin, and then go ahead and record the vaccine administration as you would. Moving on to the contraindications with regards to the LAIV vaccine, the first one is anaphylaxis following a previous dose of the influenza vaccine or any of its constituents, except for ovalbumin, and then we'll go through that in the precautions. Again, those with severe neutropenia to avoid an acute vaccine-related febrile illness. Um, uh, that's a contraindication, but this doesn't apply to those with primary autoimmune neutropenia who can get the flu vaccine unless there are other contraindications. And the third contraindication is with regards to those in combination checkpoint inhibitors, again, because of a potential association with immune-related adverse reactions. There are, however, further contraindications with regards to LAIB, and this includes asthma, but only in certain circumstances. For example, if there is an acute exacerbation of symptoms, increased wheezing, and/or additional bronchodilator treatment in the last 72 hours, or if they have severe asthma, if on regular oral steroids, or have had previous ICU or critical care admissions for asthma, then you should seek advice before giving LAIV. Another contraindication for LAIV is significant immunosuppression due to disease or treatment, or children who live with severely immunosuppressed people, for example, those after a stem cell transplant. Another contraindication for LAIV is a concomitant use of aspirin or salicylates. In addition, we have further contraindications listed on this slide here. Influenza antiviral medications within the previous 48 hours. Pregnancy is another contraindication, and those who are post-cochlear implant, until the risk of the CSF leak is resolved, it's contraindicated, but you should consult with the relevant specialist. And those with a cranial CSF leak, and that's again a contraindication for LAIV. Note that if an eligible child for the flu vaccine is contraindicated LAIV, they should be given the QIV vaccine, provided that's also not contraindicated. Note that the following are not contraindications to LAIV, including asymptomatic HIV infection and children receiving topical or inhaled corticosteroids, low-dose systemic corticosteroids, replacement therapy corticosteroids as well. Moving on to the precautions associated with LAIV, vaccination should be deferred from an acute severe febrile illness until recovered, from an acute severe febrile illness. The next precaution is with regards to egg allergy. NIO advises that LAIV has a low ovalbumin content. Therefore, it can be given to children with a confirmed egg anaphylaxis or egg allergy in a primary care setting or school setting. The only exception is children who've had ICU admissions for a previous severe anaphylaxis to egg who should be given LAIV in hospital. And note that LAIV is the preferred vaccine for children who've had previous admission to ICU for a previous severe anaphylaxis to egg, as the intranasal route is less likely to cause systemic reactions, but it should be given in hospital. Just note that after vaccination with LAIV, paracetamol or ibuprofen can be given for common side effects, but do avoid aspirin or salicylate for 4 weeks, unless, of course, it's medically indicated, because Ray's syndrome has been reported after salicylate use during wild-type flu infections. And also avoid influenza antiviral medications for 2 weeks. And on the right-hand side, you see the tear pad that will come with your LAIV vaccine delivered by the cold chain, and that's just a post-vaccination advice record and also information for the parents as well. So I suppose the next thing to talk about really is the flu vaccine ordering and storage. As per previous seasons, very similar. You will be ordering your flu vaccines online at ordervaccines.ie, which is the portal for our HSE National Cold Chain Service, and you'll be ordering it as per the order dates. And the National Cold Chain Service will communicate with you once orders are, when orders are open for when you can order the flu vaccine. And when orders are open, you can order up to 100% of your QIV allocation with fortnightly deliveries commencing on the 18th of September as per your delivery calendar. LAIV or Fluenz Tetra, you can order it based on, vaccine clinics that are planned. Make sure, you can get fortnightly deliveries of this vaccine. The start date for the deliveries will be the 25th of September, as per your delivery calendar, but note that this vaccine will expire on the 29th of December 2023. So again, very short expiry date. Always check the vaccine before administering to a patient. And note, as I mentioned before, patient-held vaccination record cards for QIV and post-vaccination tear pad leaflets for LAIV will be delivered with the vaccine, which should be completed and given to your patient after vaccination. As we always say, please only order the amount of vaccine that you'll be requiring before your next delivery, and plan your clinics accordingly, as deliveries will be fortnightly. And in terms of storage, just to reiterate, all flu vaccines should be stored in a pharmaceutical fridge. And you'll see on the NIO website, you'll find standard operating procedures on how vaccines should be stored. But the flu vaccines need to be stored in a pharmaceutical fridge between 2 and 8 degrees Celsius. You should keep the pre-filled syringes in the outer carton in order to protect them from light. And note that all vaccines are sensitive to heat and cold. Heat actually speeds up the decline in potency of most vaccines and reducing the shelf life. Also remember not to freeze vaccines. If a vaccine has been frozen, it should not be used because freezing can cause increased reactogenicity and a loss of potency for some vaccines. And more importantly, it can also cause hairline cracks in the container, leading to contamination of the contents as well. So really important to store vaccines properly and in line with guidelines. Next, we'll be moving on to the eligible cohorts for this upcoming flu season. So very similar to the previous flu season, and the main changes really are the children. So last season, all children aged 2 to 17 were eligible to get the free HSE flu vaccine, and they would have been offered LAIB. This season, as per the Department of Health policy, only all children aged 2 to 12 years at the time of vaccination will be offered the LAIB vaccine. If a child is aged 13 to 17 years and they're in the at-risk category, on the right-hand side, for example, if they have diabetes or they have heart disease or lung disease, and they're eligible because they're in the at-risk category, they can still get the LAIB vaccine, but the vaccine will not be universally available for children aged 13 to 17. So it's only for the at-risk children. So I suppose going through the recommended groups of vaccination, as I said, is for all children aged 2 to 12 years. Really important group is people aged 65 and over, pregnant women, and remember that the vaccine can be given at any stage in pregnancy, all health and care workers, all residents of nursing homes and other long-stay institutions, carers and household contacts of people with increased medical risk, people in contact with regular contact with pigs, poultry and waterfowl as well. And for those who are in the at-risk category, so those aged between 6 and 23 months, and those aged between 13 and 64 years, as I mentioned, these are the at-risk categories, including chronic heart disease, chronic liver disease, chronic neurological disease, chronic renal failure, cancer patients, chronic respiratory disease, diabetes, Down syndrome, hemoglobinopathies, immunosuppression, morbid obesity, those on long-term aspirin therapy with any condition that can compromise respiratory function, and those with moderate to severe neurodevelopmental disorders. Just, I suppose, a further note on the recommended groups of vaccination, only those who are in the HSE's target eligible groups for the flu vaccine should receive the flu vaccine that's supplied by the HSE's National Cold Chain Service. Anyone who's in the eligible group should be supplied the who are receiving a HSE supplied vaccine in the eligible groups should not be charged a fee for the administration of the vaccine, even if they don't have a medical or a GP visit card. And just a reminder about the eligibility around household contacts and carers. Only household contacts or carers are people who have an underlying chronic health condition or Down syndrome are eligible to receive the flu vaccine. A carer is described as someone who's providing an ongoing significant level of care to a person who's in need of care in their home due to illness or disability or frailty. For example, those in receipt of a carer's allowance. For all other groups who wish to receive the flu vaccine who are not part of the eligible cohorts, privately procured stock must be used, and this is a private arrangement as per previous seasons. And just to talk really quickly, I suppose, around the flu vaccine uptake for the 2022-2023 season that's just gone by. Just for your interest, I suppose these are the provisional results that have been provided by HPSC for us. For children aged 2 to 17, you'll notice that the uptake is very low at 15.4%. For people aged 65 and over, we again reached the WHO target of over 75%. So last year we achieved 75.7%. For those with underlying health conditions, over 225,000 people were vaccinated, and over 23,000 pregnant women were vaccinated as well. Another key group, I suppose, is residents within long-term care facilities, where there can be an increased risk of flu outbreaks. So really important cohort who are getting the who need to get the flu vaccine early this season. So the uptake in those facilities was high at 91% in the HSE side, and again, similarly, very high in the non-HSE side as well, in the long-term care facilities, and coming up to nearly 96% there. So that's positive. And I suppose I just wanted to kind of quickly focus on healthcare worker uptake. This slide quickly shows, in terms of the dotted line in particular, if you cast your eye over it, we've seen a really good increase in uptake in healthcare workers over time. But pre-pandemic levels, you'll notice that for even with the peer vaccination program, which started when as indicated by the red line, the uptake was just below 60% in the public hospitals. And in long-term care facilities, again, with the advent of the peer vaccination program, we see an increase in uptake over the years as well. With uptake pre-pandemic, in 2019-2020 season, coming up to around 45%. I suppose what's worth noting is more the uptake levels that we've seen, based on the point prevalence survey that HSE take each year. You'll notice that the uptake in hospital patients during the height of the pandemic in 2020, 2021, it had reached 71%, but slowly we've seen actually a very sharp decline in uptake over the last few seasons. So it's just worth noting that we do need to kind of talk to healthcare workers, help them make an informed decision about vaccination this autumn. Just in terms of uptake targets, so obviously the EU and WHO recommend that the target coverage of 75% or over for older people and persons with chronic disease illness. For the vaccine uptake target, as discussed with the National Flu Steering Group, we are once again, it's really important that we reach the 75% target for our high-risk population, which is adults aged 65 and over. We also want to reach the 50% target for children this year, for children aged 2 to 12. And again, we have an ambitious target of 75% for our health and care workers, because it's a really important cohort that are vaccinated this season. Just wanted to focus on a couple of the eligible groups and why it's so, they're a key priority for us this year. Although the vaccine uptake target for older adults has reached 75%, we mustn't let that, the gains slide. And it's important that we maintain that high uptake coverage in this cohort. That's because people aged 65 and over are at severe risk of severe illness, hospitalization, or even death from flu. And as I mentioned before, 80 to 90% of reported deaths occur in the elderly. And research by HBSE shows that, between 400 and 800 excess deaths may be due to flu in Ireland each season, and between 1,000 and 1,200 excess deaths may be due to flu in a particularly severe flu season. And unfortunately, the majority of deaths occur in people aged 65 and older. The next important cohort that we wanted to touch on is around healthcare workers. As I mentioned to you, with the uptake rates, we really do need to increase that uptake rates. And the reason for that is up to 3/4 of people, as I mentioned before, have no symptoms, but they can transmit infection if they do have flu. This means that healthcare workers can spread infection even when they have no symptoms. And unfortunately, healthcare staff, because of the areas that we work in, we're up to 10 times more likely to get flu compared to the general population. And it's estimated that at least a fifth of healthcare workers are infected with flu each year and may continue to work despite being ill, which increases the risk of spread to flu to both colleagues, but also to patients as well. It's worth noting that during hospitalizations, patients in general are 5 to 35 times more likely to acquire flu if they're exposed to infected patients or healthcare workers. So it's really important that they get vaccinated to protect themselves as well. and institutions with high levels of healthcare workers, immunizations in Europe have shown reduced rates of flu-like illness, hospitalizations, and deaths from flu in the elderly, and also a reduction in healthcare workers' sick leave. So it's really important for the business continuity as well, and our winter preparedness and resilience. It's worth noting that every healthcare worker should be getting the flu vaccine. This includes medical and nursing and allied health professionals, both working in working in the acute community settings, but also in residential disability services, general medical general support staff, dental personnel, hospital porters and cleaners, ambulance personnel, all carers and home helps, all GP and pharmacy staff, and also any agency staff who fall in the above categories. Next, moving on to another key cohort that I mentioned to you that I'll go into further detail is around flu in children. So the reason for this, it's a really important cohort, is that up to 10% of all children under the age of 15 attend GP with influenza-like illness each season. And it's worth noting that the common complications of flu for children are bronchitis, otitis media, sinusitis, and secondary bacterial pneumonia. Less commonly, you have meningitis, encephalitis, and primary influenza pneumonia. It's worth noting that children under the age of 5 are at the highest risk of complications. Therefore, they're also recommended vaccination by the WHO. And it's also worth noting that the age-specific rates are high. Children are at the highest rates of, in terms of the children under the 5 have the highest rates of hospitalization, but also highest rates of admission to critical care as well. And I just wanted to share the slide with you as well to show the burden of pediatric flu. So last season, this is the one figure that really sticks with me. 1,217 children under the age of 15 were admitted into hospital with flu last season. And it's worth noting that, we have a really effective flu vaccine that's safe. So, but only 15.4% of eligible cohorts had actually received the vaccine. So it's really important that we encourage parents to consider this vaccine when they're coming to us. It's also worth noting the burden of pediatric influenza over the last 10 years, between 2009 and 2018-19 season. During those 10-year period, HPSC estimate that there was over 11,000 notifications of flu, over 4,750 flu hospitalizations, 183 critical care admissions, and 41 flu-related deaths. So the aim of influenza vaccination program for children is, you want to protect children from influenza-related morbidity and mortality, but also remember that children can transmit flu for longer than adults, for 10 days or more when compared with 6 days in adults. And also children attending daycare centers and schools are also important transmitters of flu in the community. So the secondary objective of this program is also to decrease the number of people with flu, number of hospital admissions, also the transmission of flu to elderly and persons at risk, and also transmission to healthcare workers and families with children. It's worth noting that a high uptake for the flu vaccine in children is really important for our winter preparedness. For example, when you look at the UK, where they administered the flu vaccine in schools, they really increased their uptake rates there. And what this resulted in was a reduction, 94% reduction in primary school age children with GP influenza-like illness consultations, and also in primary school age children, they saw A&E respiratory attendances was 74% lower, and hospital admissions due to confirmed influenza was 93% lower, and you also saw an impact in the wider community as well, because GP influenza-like illness consultations were 59% lower in adults. So suppose to dive into a little bit deeper, we actually undertook a survey of parents at a national level in Ireland, and it shows that a number of parents do want to get their children vaccinated. So the vaccine intention appears to be there. So, for example, 48% of parents said they'd be happy to get the flu vaccine for their child, and another further 23% said they're not sure, but they'd be the ones who'd be amenable to a discussion with their healthcare provider on the flu vaccine. So really our uptake rate should be a lot higher than 15.4%. And as I mentioned, this is this has been a trend that, low uptake rates has been a trend since 2020 when the flu vaccine was introduced into the program. But not only is the uptake low, but we're also seeing a wide amount of variation between the counties as well. So, for example, the last season, we see a Cork and the uptake rate is 19.4%, and all the way in counties such as Monaghan and Donegal, where the uptake rate is 6.2% as well. So, again, the other key issue with the children's flu program is the wide variation uptake across the counties. So there are a few things that we're doing this season to improve uptake. So the first thing we're doing is we're extending the school vaccination program to include the flu. So the HSE mobile vaccinators will be administering the nasal flu vaccine on site to just senior infants in mainstream primary schools and also to all children in primary age special schools who are, across Ireland between the periods of October and December this year. GPs and pharmacies can also link in with local primary schools and childcare settings to offer the nasal flu vaccine. It's recommended that because obviously our HSE mobile vaccinators will be offering it to senior infants in mainstream schools. It's recommended that in primary schools they approach junior infants and also offer the vaccine to those in the first and sixth class. And they can also vaccinate children in creches as well. But note that this is a private arrangement, but we will be supporting you with a toolkit and consent form. And there's obviously patient information material as well that's available to you that you can share with parents to help you support this activity as well. We will also be relaunching the pharmacy finder service as well, so parents can find a local pharmacy that's offering the nasal flu vaccine for their child as well. Next, I suppose I just want to touch a little bit on the operational pathways for the eligible cohorts. And as I mentioned a little bit, from the 2nd of October, the HSE mobile vaccination teams will be offering the flu vaccine to the following cohorts. So the first one is our long-term residential care facilities. So as per the previous year, they will be offering it to the residents, to all residents within all the long-term residential care facilities, the flu vaccine, regardless of age and regardless if they need the COVID-19 booster. Healthcare workers in these settings can also receive the flu vaccine from the mobile teams. But, the healthcare workers have other avenues as well. For example, they can get it from their local peer vaccination service. They can also access the vaccine for free through participating GPs and pharmacies as well. And note that for this particular activity in the COVID-19 teams will be ordering the flu vaccine that they require for this. So therefore, it's recommended that long-term residential care facilities are advised not to order the flu vaccine for their residents. From the 2nd of October, HSE mobile vaccination teams will also be offering it to the following cohorts, which includes housebound patients. So all housebound patients who are eligible for the COVID-19 vaccine will also be offered the flu vaccine. If they're not scheduled for a COVID-19 booster, they won't be offered the flu vaccine unless they're referred through the appropriate pathway for a flu vaccination. And also note that children in senior infants and all children in primary age special schools, as I mentioned before, will be offered the nasal flu vaccine by the HSE mobile teams between October and December. The other avenue for vaccination for healthcare workers in the acute and community settings is the HSE-run flu peer vaccination program. And as I mentioned before, that's been really the core way that vaccine uptake has improved within healthcare workers in the HSE. And the flu peer vaccination program will continue to offer the flu vaccine for health and care workers in the community and hospitals this flu season in their workplace. And health and care workers can also access the free flu vaccine, as I mentioned before, at GPs and pharmacies. Where possible, health and care workers should also be enabled to access the COVID-19 vaccine together with their flu vaccine. And where local areas wish to provide both COVID-19 booster clinics and flu vaccine clinics jointly, in their healthcare setting or at a local COVID-19 vaccination base, this is a local arrangement that needs to be discussed. The next administration pathway that I wanted to talk about is primary care. So it's worth noting that primary care is obviously a really critical channel flu administration. And for example, last season, over 63% of the 1.24 million flu vaccines that were administered in general practice, and a further 29% were administered in pharmacies. So primary care is really where a bulk of the vaccinations for the flu program are undertaken. So it's expected that all other eligible cohorts, other than the ones that I discussed in the previous couple of slides, will be vaccinated in primary care. And this includes older adults, people aged 65 and over, people at high risk of flu-related complications, pregnant women, carers and household contacts of people with increased medical risk, people with regular contact with pigs, poultry and waterfowl, and health and care workers who are unable to access the flu vaccine at their workplace. So next, I just wanted to touch briefly on the PBV23 vaccination program. So Pneumovax 23 vaccine, contains 23 of the most commonly capsular types of Streptococci pneumoniae, and this vaccine is recommended for those aged 65 and over, and also at-risk adults and children over 2 years of age. Vaccination is not recommended for healthy children and young adults, as there's little risk of pneumococcal infection. So just to go through really, in terms of adults aged 65 and older, who've never received a PPV23 vaccine, only require 1 dose. That's irrespective of immune status. And it's a once-only dose that they require. And the once-only dose booster vaccination is recommended 5 years after the first vaccination for those who received a previous dose at less than 65 years of age. So if you've turned 65 and you received a previous dose of PPV23, what that's saying is that you only require 1 more dose once you've turned 65, but you need to wait for 5 years from your first vaccination. For people under the age of 65, 1 booster vaccination is recommended 5 years after the first vaccination for those whose antibody levels are likely to decline rapidly. For example, asplenia, hypersplenism, immunosuppression, including HIV infection, chronic renal disease, nephrotic syndrome, or renal transplant. And those who receive PPV23 at less than 65 years of age require 1 further dose of PPV23 booster at or after age 65 or over, 5 years after the previous dose, as previously mentioned. And if PPV23 was given during chemotherapy or radiotherapy, a further dose is recommended 3 months after treatment. There is a lot of information there, and to make it easier for you, we've actually developed algorithms, 1 for people aged 65 and over, and 1 for people under the age of 65. And this is a really easy to use decision tool to help you understand if the person in front of you requires a PPV23 vaccine. And note, the reason why we're talking about PPV23 is usually given, because your older adults will be coming, those aged 65 and over will be coming. It can be given at the same time as the flu vaccine. And for this particular vaccination program, we do have a number of resources that are available for you, including a HSE land module, a frequently asked questions for healthcare professionals, and we also have a patient information leaflet that's been produced by the HSE as well. Next, just to briefly touch on the ICT system for recording flu and PPV23 vaccinations, we'll again be using the COVID-19 vaccinations ICT system called COVAX for capturing immunization records for flu and as well as PPV23 vaccines. For non-primary care locations, all non-primary care vaccinators will need to record any HSE flu vaccines administered either directly onto COVAX, or if you're a Section 39 or private healthcare facility, you need access to the Community Vax portal to send us the data into COVAX. So that will be for non-primary care. For primary care, the GP practice management systems have been reconfigured, and the HSE's PharmaVax and GP Vax systems have been updated to enable COVID-19, flu, and PPV23 vaccination records from GPs and pharmacies to transmit electronically from their software to COVAX, and then the COVID-19, flu, and PPV23 payment claims, if suitable, will be sent to PCRS team as well. Next, I just wanted to talk about the available resource for vaccinators. I'm just going to bring in Yvonne just to quickly touch on these 2 couple of slides.
Thank you, Aparna, and thanks a million for all the information you've shared so far. So I've been sharing some of these resources already in the chat function, but just to briefly talk through what will be available for this year. So as Aparna mentioned, our target groups mainly for our communication campaign for 23-24 are going to be children aged 2 to 12, the at-risk groups, and then our health and care workers as well. So we're planning to launch a nationwide campaign at the beginning of October. We will also be hosting our flu awards at the end of that week. So that's where we have a look and see the great work that was done the season before, and see can we share all those great pieces of information about how people increase that uptake, so that other people can also have that opportunity to do that. I know this evening we've just spoken about flu, but just to remind people that for this winter, we will be talking about flu vaccine, we'll be talking about COVID vaccine, and we'll also be talking about pneumococcal vaccine. We know there's an awful lot in the vaccine space, but look, these vaccines are incredibly important. So look, our objectives for this year, and we can't do this on our own, and I know there's an awful lot of work goes in across the country to do that, is to try and achieve those target uptakes for 23-24. As Aparna shared earlier, there's an awful lot of those are at 75%. The big thing as well is we want to give everyone who can get the free flu vaccine the information that they need to make an informed decision. So we spend an awful lot of time asking people what kind of information they would like to receive, what kind of questions they have, and you know, COVID has changed an awful lot for how everybody looks at information and how we absorb that information. So we use all the different channels we have to try and share as much information as we possibly can across different areas across the country. And I suppose because, look, we are the HSE, we are the National Immunisation Office, we really want to position the HSE as a trusted source of information, and we're very lucky that we have Aparna leading that service for us from our office. But, you know, when you come to the HSE, you know the information is going to be up to date, it's going to be credible, and even as things progress throughout the season, we'll continue to update all of those resources. So Aparna, next slide, please. Thank you. So just to very quickly touch on all the different resources we have, and look, all of this information will be shared with everybody after this event. Our main public-facing website for flu is hse.ie/flu. So that's where we have, you know, your frequently asked questions, we've information materials, we've posters, and just to touch that, the information materials, so our leaflets and our posters are currently printing. They will be delivered towards the end of this month, so in time for all those vaccines to be given to patients. We have lots and lots of information for healthcare professionals on immunisation.ie, which I'm sure many of you are familiar with. We are finalising an awful lot of our documents at the minute for the upcoming season, so in the next week or two, we'll be adding more and more resources to that webpage that's there already for flu. Aparna mentioned already, we have a number of e-learning modules. So all of our e-learning modules are on hseland.ie, and it talks you through here how to get to that. I'd also want to mention that we have how to communicate about vaccines, because we've heard an awful lot about vaccine fatigue. So that's important. As always, and I know many of you use the service already, we have a healthcare professional dedicated mailbox. So many of you will have got responses from Emer and Tom and from Louise already. So that's immunisation@hse.ie. We can only take queries from healthcare professionals. If members of the public do have queries, we encourage them to contact HSE Live for additional advice. Then, as always, where all of our information comes from, it's our NIOC advice, so it's our NIOC guidelines. So those are available on the RCPI website. Up until recently, they would have been available on the immunisation website, so please make sure you update that URL. It's the RCPI website, and if you come onto our website, we will redirect you over there. And then finally, it's really important to be aware of the patient information leaflet and the summary of product characteristics, so they are available on hpra.ie. And then just one final mention, we have a number of social media accounts, so if you search for National Immunisation Office on Twitter, which is now called X, Instagram. You'll also find us on LinkedIn. We'll put this video and a number of other videos up on YouTube, and we also use Spotify. So thanks a million, Aparna, and best of luck, everybody.
Brilliant. Thanks very much, Yvonne. So just, I suppose, before we end, just wanted to kind of touch on a couple of frequently asked questions. And I know Tom, Ema, and Louise have been busy working away in the background, answering as many questions for you as possible. And just to let you know, we do have quite a wealth of FAQs on our website. And any new questions, I should say, that we find in the chat function, we'll add them onto those repository for this season to support you as vaccinators. But just to touch on a couple of commonly asked questions, one is around co-administration. Just to note, all flu vaccines and other vaccines, including COVID-19 vaccines, may be administered at the same time or at any interval. Except for PCV23 for children aged 12 to 23 months. This should be separated for 1 week due to the risk of febrile convulsions, as mentioned before. Another question we always get is around LAIV. LAIV can be administered at the same time or any time before or after any other live vaccine, example MMR or varicella, or non-live vaccine as well. And PPV23, as mentioned before, can be given at the same time as the flu vaccine. Just a little bit more on the co-administration with COVID-19. Just to note that COVID-19 and adult seasonal flu vaccines can be co-administered where practical to maximize uptake, and co-administered vaccines should be given in different arms, and vaccinees should be informed that there is a slightly increased risk of short-term mild adverse events after co-administration with the seasonal flu vaccine and the COVID-19 vaccine. This includes pain at the site of injection, fatigue, headache, and myalgia. Just note that as a precaution, the only group where co-administration can't happen is for children aged 6 months to 4 years. This is because of a precaution where it should be separated from the flu, and COVID-19 vaccine should be separated in this age group by 14 days until more evidence is available. So in terms of expiry date, I think we touched on this quite a bit during the webinar anyway, but just to note again that the LAIV expiry date is much shorter than other vaccines, 18 weeks from the date of manufacturing, and the expiry date is written on the side of the nasal applicator as a day, month, and a year, as the last date the vaccine can be administered, and the expiry date may not necessarily be the last date of the month. So the key point there is always check the expiry date of any vaccine carefully before administering it. And with regards to LAIV, what happens if a child sneezes or nose drips, or if it's only given into one nostril, or all of the vaccine is given into the same nostril? The key message there is that the vaccine doesn't need to be repeated. In terms of the recommended vaccine by age, as I mentioned before, Influvac Tetra is the vaccine that's available for all children aged 6 to 23 months, and also all adults aged 18 and over who are in the eligible cohorts. And our Fluence Tetra, which is the nasal vaccine, is available for all children aged 2 to 12, and also at-risk children aged 13 to 17. It's worth noting a couple of seasons ago we had the adjuvanted QIV called Fluad Tetra as part of the program. That's not been available for the last 2 seasons, so it's not available this season either. So all older adults are recommended the QIV vaccine. In terms of egg allergy, I think it's worth reiterating, as we get a number of questions on this. Those with a confirmed egg allergy or an egg anaphylaxis can be given the flu vaccine in primary care or a school setting. The only exception is those who required ICU admission for a previous severe anaphylaxis to egg. And note that LAIV is the preferred vaccine for children who've had a previous admission to ICU for a previous severe anaphylaxis to egg, as the intranasal route is less likely to cause systemic reactions, but it should be given in hospital. And those requiring non-live flu vaccine who've had a previous ICU admission for a severe anaphylaxis to egg should be referred for specialist assessment in regards to vaccine administration in hospital too. Just in terms of adverse reactions for the LAIV, the most common local ones is nasal congestion is very common. In terms of general reactions, malaise is very common, decreased appetite, headache, myalgia, fever also common, and fever is no more frequent than that following other recommended childhood vaccines, and is generally mild and resolves in a few days. And very rarely you might see immediate allergic reactions. Note that very rare reports of GBS or Guillain-Barré syndrome have been observed in the post-marketing surveillance setting following administration of QIV, but note that the risk of GBS is several times greater better following flu illness than following flu vaccination. And you can read more details within the HPRA website, summary of product characteristics for Influvac Tetra, for Fluence Tetra, for more information on adverse reactions related to LAIV. So with regards to the adverse reactions related to the non-live QIV, the injection sites, pain and swelling are very common. In general, adverse reactions include fever, fatigue, myalgia, and irritability in young children, which are very common. Drowsiness, sweating, and arthralgia are common, and very rarely, again, you may note immediate allergic reactions. Again, similarly, very rare reports of GBS have been observed in the post-marketing setting following administration of QIV, but the risk of GBS is several times greater following flu illness than flu vaccinations. Again, review the SMPC for the full list of adverse reactions for Influvac Tetra. And just a quick reminder, flu vaccine recipients should be observed for at least 15 minutes after vaccination. If this is impractical, vaccine recipients should wait in the vicinity for 15 minutes. You should have all of the available protocols, equipment, and drugs necessary for the management of anaphylaxis, and this should be checked before each vaccination session. And in terms of post-vaccination advice, you should advise them to report any possible adverse reactions to the note, any side effects to HPRA website. It takes around 2 weeks after vaccination to have the protection against flu, and also they should be advised that there's still a chance they may get flu, so it's important to follow all public health advice. I suppose just to close off with, because we're reaching 9 o'clock, if there are any further questions, do reach out to us, as Yvonne mentioned, at immunisation@hse.ie. And thank you all for your patience. And as mentioned before, this webinar will be available on our HSE website, immunisation.ie.